Hi, my name is Tim. I have been assigned to research Crohn's disease, and this is what I have found. Crohn's disease is a chronic, relapsing, systematic inflammatory disease which affects a wide range of your gastrointestinal tract. This disease can affect anywhere from your mouth to your anus. Before we look further into Crohn's disease, let's look at the normal physiology of the gastrointestinal tract. The GI tract includes a series of organs, such as the mouth, esophagus, stomach, small intestine, large intestine, and the anus. The normal function of the GI tract includes transportation and digestion of food, absorption of nutrients into our blood and lymph, and expelling of waste. Physiology. The digestive process consists of ingestion, propulsion, mechanical breakdown, digestion, absorption, and defecation. The food enters the mouth and then travels down the esophagus into the stomach, where the food gets broken down into chyme using the protein digesting enzymes like proteases and gastric acids. The chyme then travels to the small intestine, where the absorption of nutrient takes place. The remaining substances travel to the large intestine via peristalsis, where water is absorbed and the remaining waste gets stored for excretion out of the anus. Pathophysiology. Inflammation occurs anywhere within the GI tract, more commonly within the lower section of the small intestine and the beginning of the large intestine. The large intestine contains a series of normal bacteria that help aid in digestion and is protected from immune attacks. Our immune system attacks foreign invaders such as viruses, harmful bacteria, and fungi. In individuals with Crohn's disease, their body mistakenly reads the good bacteria as foreign and begins to attack them. This is due to antigen hypersensitivity. This initiates the immune system. The immune cells travel from the blood into the large intestine, which produces inflammation. In this process, chemicals such as histamine, bradykines, and prostaglandins are released. This leads to increased capillary permeability, and the blood flow travels to the area of harm, which causes inflammation and narrowing of the blood vessels. This increased permeability allows new attracted leukocytes from the blood, such as monocytes, neutrophils, and leukocytes, to enter into the affected tissue. This leads to phagocytosis and destruction of the pathogens. Once the intruders are destroyed, the inflammation settles down. However, in Crohn's disease, the inflammation does not subside. This leads to chronic inflammation, ulceration, and thickening of the intestinal walls, which causes the symptoms of this disease. Symptoms. Crohn's disease can occur slowly over a period of time, rapidly or all at once. However, sometimes there are no signs or symptoms at all. Symptoms include diarrhea, fever, fatigue, abdominal pain, cramping, blood in stool, mouth sores, reduced appetite, weight loss, and overall lack of energy. Individuals with severe Crohn's can have further symptoms such as increased inflammation of the skin, eyes, joints, liver, bile ducts, delayed sexual growth in children. Risk factors. Crohn's disease can be due to hereditary, age, ethnicity, genetics, cigarette smoking, non-steroidal anti-inflammatory medications, geographic location, diet, and malfunctioning of the immune system. Treatment. Unfortunately, there is no cure for Crohn's disease. However, there are many alternatives the individual can consider to subsidize the pain and inflammation. This could include using anti-inflammatory drugs, immune system suppressors, antibiotics, nutrition therapy, surgery, and holistic therapy. Furthermore, Crohn's disease can be reduced by making some changes in your lifestyle, such as changing your diet, not smoking, reducing the amount of stress, or using alternative medicine. Now that we are aware of Crohn's disease, let's listen to what my Aunt Tracey has to say about living with Crohn's disease. So, Auntie, when were you diagnosed with this autoimmune disease?
I was diagnosed in 2005 with Crohn's disease. However, I knew about it when I was younger. They told me all along it was IBS. But officially I was diagnosed in 2005.
What are your symptoms?
My worst symptoms are diarrhea, abdominal pain and cramping, and fever, low-grade fevers.
Okay, I'll try and explain the pathophysiology between your symptoms. Ulceration causes swelling and inflammation of your submucosal layer in your intestine, which causes abdominal pain and fever. The deepening of your intestinal walls affects absorption of nutrients and water, which can also cause diarrhea. How do you manage this?
I used to use conventional medicine. I have tried conventional and biologics. But by trying biologics, it created me with another autoimmune. So now I manage and use mine with natural or holistic measures. I use essential oils. I get plenty of sleep. I make sure that my stress levels are really low. And I eat properly, I do meditation, and I always do something for myself every day.
Wow, thank you, Auntie. Appreciate this.
Thank you.
Key concept: homeostasis. Normally, the GI tract aids in digestion, absorption of food, water, and nutrients. However, Crohn's disease causes chronic inflammation and impairment of the mucosal functioning, making it difficult for the GI tract to do so. Proteins. Many proteins are involved in the inflammatory response, such as histamine, bradykinin, and prostaglandin. Toll-like receptors can also be found in luminal epithelium, where they recognize specific commensal microorganisms. Cell membrane. The cell membrane is disrupted when the epithelial layer increases in permeability, allowing pathogens to leak through the mucosal layer with less resistance. I hope this presentation gives you more insight about Crohn's disease. Thanks.